In this clinical teaching guide, we will focus on navigating difficult learning situations. Challenges are common, and educators should be prepared to teach through these situations, as medical students will one day have to face them on their own. There are several factors that contribute to difficult learning situations. Let's walk through these together. Death and dying is one of the most common stressors for doctors in training. Encourage your learners to pursue healthy coping mechanisms through self-reflection, self-care, and work-life balance. When medical errors occur, it's important to stress healthy coping mechanisms here as well, such as emotion-focused coping, which centers on mindfulness, and problem-focused coping, which centers on troubleshooting. Avoidance coping is an unhealthy coping mechanism in which the problem is either ignored or repressed via psychological or physical methods, such as drugs or alcohol. Giving bad news is difficult, but the student needs to see it done in real time. Ensure that the student is prepared for an emotional response and take time to debrief the situation with the student afterwards. Make sure your student understands the methods of discussing complex diagnoses with patients by naming the disease, explaining the symptoms, describing disease management, and setting expectations with the patient. Being culturally competent is essential for the medical profession. Take advantage of recent advances in interpretation technology to elevate your communication and minimize language barriers with your patients. Some ethical dilemmas you may encounter are listed below. High-pressure situations arise when a case takes an unexpected turn. Establish a plan for your student in case an emergency arises, and ensure the student understands their role. End-of-life care can bring about very emotional conversations for the patient, family, and the medical team. Take time either before or after these conversations to educate your student on why plans changed and how to cope. The medical field is a team sport, and with many medical professionals in the mix, there's always the potential for conflict to arise. Remember that underneath each conflict, every physician wants what's best for their patient. Non-compliance can originate from a variety of barriers. Although frustrating for the physician, it is essential to model a non-accusatory approach toward patient non-compliance for the student. Here are the takeaways from this guide. Use every patient encounter as a teaching opportunity. Note where students can improve in managing difficult situations. Use your knowledge as a physician to prepare the student for situations in advance, and encourage your student to utilize healthy coping mechanisms throughout the clinical experience. This video is produced by the Office of Faculty Affairs and Development at the Burnett School of Medicine. Thank you for watching.